Last year, I interviewed Dr. Shazma Mathani, who's an ER doc in Edmonton, about how the Alberta acute healthcare system was coping with COVID-19. It was right on the brink of collapse at that time, and here we are a year later, staring down the same barrel. So I want to talk to her again, see where we're at. Welcome, Dr. Mathani.
Thanks for having me today.
Shazma, when we talked last, and I interviewed a number of doctors and nurses, everybody was exhausted, burned out, depleted because of the pandemic. Here we are now, we've got doctors and nurses leaving the system. Is it worse than it was then?
It certainly feels like it's heading in that direction. We're in a very different situation than when we talked last. I think it was during the second wave, where our numbers are climbing in a dramatic way, but we have no basic protection measures in place anymore, right? So during the second wave and the third wave, there were public health measures that were in place to help mitigate the spread, and the cases continue to rise, right? We're in a situation now with the Delta variant being more transmissible and causing more severe disease, that's being allowed to spread without any mitigating measures in place, right? And so we are seeing a much more rapid rise in cases with much faster exponential growth. And we are seeing people coming with more severe outcomes. I mean, we do have the protective measure, of course, of vaccinations, but our numbers in Alberta are not nearly high enough to offer the amount of protection that we need. And we are definitely starting already this early in the fourth wave to see a big strain on hospitals.
Well, look, I want to ask you a question that I see on social media from panicked parents all the time. And that is the fact that the Delta variant appears to infect children under 12, whereas the original Alpha variant did not. What's your take on that, and how likely is it to be an issue in Alberta?
I'm certainly concerned as a parent myself. We know from data out of the United States that Delta is more transmissible in kids and is causing more severe disease in kids as well. School opens very shortly, in a matter of days in some places in Alberta, and we are sending a population who does not have the eligibility to be vaccinated, so kids under the age of 12, into schools that are indoors, mostly poorly ventilated spaces. And most kids in the province not being masked, right? There are actually only a couple of school boards or a few school boards in the province that have decided to institute mandatory mask mandates, and the rest of the province, it's voluntary and up to the child and the parent. And so I certainly have a large level of concern with what's going to come in the next couple of weeks as school starts and as COVID has the opportunity to spread very rapidly in those situations.
So kids go back to school. If there are a rise in children who are infected, and that would appear to be, from what you've said and the comments I've heard from other doctors and from the data from the US, that this wave is going to infect some percentage of children, how ready is the Alberta acute care system to handle those cases?
It's going to be tough because remember that in previous waves, the way that we were able to increase capacity is actually by taking over pediatric spaces. So the adult ICU was spilling over into the pediatric ICUs in both Edmonton and Calgary. But if we have both adults and children who are getting sick from this, that's going to become a big crunch pretty quickly. And that's not even discussing yet the staffing concerns that we've been having, right, with decreased capacity because of that. And so, as you mentioned, Markham, as case numbers go up, although children tend to be less severely affected, thankfully, once you start having tens of thousands of children infected with COVID-19, you will see severe outcomes. It's a numbers game, right? And so I am concerned about the ability of our acute care system to handle capacity, not only from adults, but now from children as well.
I just interviewed Dr. Joe Vipin, a Calgary ER doctor, and he said that data at this point shows 8 to 13% of infected children will develop long COVID. Is that a concern in Edmonton?
Absolutely. We are still early enough, relatively early enough in the pandemic, that we still don't have a complete understanding of what long COVID will entail and how long these symptoms are going to last for, right? And so we're seeing it across all age groups, that people who were infected, even with a mild illness from the initial COVID infection, have lasting effects on their lungs, on their brains, on their cardiovascular system for weeks and even months, and up to over a year in some cases that I've heard of, after their acute mild illness. And so that's definitely a concern, because there is going to be ongoing chronic illness and disability that could come from this.
Shazma, thank you very much for this. Really appreciate your insights, and good luck in Edmonton.
Thank you so much.